You thought Obamacare had you covered, didn't you? Well, you're wrong again. Enrollees, you might have not the insurance that you think you do after all. After a month of intense fixes and even a promising spike in enrollment, insurance companies have now come out to say that they're not always getting their customers' information from healthcare.gov, and the Obama administration isn't disclosing the extent of the problem. Zach, this is a shocker. Something's wrong with the healthcare and Obamacare. People aren't telling us the whole story.
Yeah, big surprise, right? I think the thing that's interesting here is, the PR campaign for how the website was fixed. Earlier this week, last week, there was this big fuss from the administration that we've made a lot of progress, and it turns out they have made a lot of progress. A lot of the stuff that wasn't working on the website is now working, but the website was so badly broken that you could actually go sign up for health insurance and not end up getting covered. And I think one of the things that's really terrible about this whole website problem is
how widespread is that problem, though?
They don't even know. I mean, they think it's widespread enough that there are industry groups in the insurance industry that are making a big deal about how, okay, we're going to try and clean up this mess so that we don't have a total catastrophe on our hands in January when people start going to the doctor, thinking that they're covered, and then find out, okay, well, that's a $10,000 knee surgery or something.
Right.
I think this is the type of problem for Obama that could have been avoided from a public relations standpoint, because signing up for insurance has always been really, really terrible. It's always been really frustrating, and dealing with insurance companies has always been super annoying. Now this website is so bad, it's actually made that process worse and made people blame the government for things that are typically frustrations they direct at the private sector. So I think this has really turned into a serious problem for the administration, and I don't really know what how this ends up being cleaned up from a PR perspective.
Is there an end in sight, not to the PR piece of it, but the actual functionality piece of it? In other words, in 6 months, will we be saying, okay, at least everything works? We're still complaining about it, but at least it works.
I mean, that's the thing. Like, if you're not actually signed up for health insurance, right? You think you were. If the insurance company never actually got the data, I mean, they could make a reasonable complaint. Like, look, we should not be responsible for paying claims, for paying benefits if we never actually got the information and this person was never signed up into our system. It becomes a real problem. Who is liable for that situation? Clearly, you don't want somebody to be paying $10,000 for a surgery they thought was going to cost $200 or something.
Right.
But it's really unclear who you do end up getting to pay for this stuff, and it could be a really complicated legal battle getting say the government to pay for it, and that's not good.